Have you ever noticed a small moment when your thoughts felt slightly out of step with your day? Not dramatic, just quietly different, and wondered if it really mattered. One of my patients once shared with me that she felt embarrassed bringing up her confusion because it came and went so gently that she worried she might be imagining it. I want you to imagine this for a moment, sitting at your kitchen table with a cup of tea, realizing that clarity is not something you lost, but something your body may be asking help with. I am Dr. Evelyn Carter, and I have spent many years caring for older adults who value calm explanations and honest conversations. When people hear words like mental confusion connected to a virus, it can feel unsettling. I want to reassure you that this video is not here to alarm you or rush you into worry. It is here to help you understand why some changes are subtle, why they are sometimes missed, and why understanding them gently can make you feel steadier and more in control. Mental confusion is not always sudden or obvious. In older adults, it can appear as small changes in focus, memory, or awareness that blend into everyday life. Aging, stress, sleep, and illness can all play a role. From a medical perspective, understanding these changes is about observing patterns over time, not labeling or judging a single moment. Research shows that the brain responds best when information is delivered slowly and with reassurance, especially later in life. In my clinical experience, seniors do best when health conversations feel like a partnership. When we slow down and add context, the mind feels safer and the body responds with more clarity. That is the spirit of Senior Health Daily. This is a place where knowledge is shared without pressure and where dignity always comes first. If this approach feels helpful to you, please consider subscribing to Senior Health Daily, liking this video, and sharing it with someone you care about. Your support allows us to continue creating calm and trustworthy health conversations. In the next part, we will talk gently about what mental confusion really means and why early signs are often easy to miss. For now, thank you for being here and for giving yourself permission to listen with patience and care. What mental confusion really means in older adults. Mental confusion is a phrase that sounds heavy, yet in everyday life, it often shows up in very gentle ways. In older adults, it can mean moments of slowed thinking, brief difficulty finding the right word, or a sense that concentration fades more quickly than it used to. These moments can feel unsettling, but they are not automatically signs of something serious. Many people experience temporary confusion when they are tired, dehydrated, stressed, or recovering from an illness. The body and the brain are closely connected, and small shifts in physical balance can affect how clearly the mind feels. From years of caring for seniors, I have learned that confusion is best understood as a change in clarity rather than a loss of ability. A person may still be capable, thoughtful, and aware, yet feel slightly off at certain times of day. Morning may feel sharp, while late afternoon brings fogginess. This pattern matters because it tells us that the brain is responding to conditions, not failing. Temporary confusion often improves with rest, routine, hydration, and reassurance. It does not usually interfere with independence or identity. More noticeable changes are different. These may involve confusion that persists, worsens, or begins to interfere with daily tasks. A person may repeat questions more often, lose track of familiar routines, or struggle to follow conversations they once enjoyed. Even then, it is important to move slowly and observe over time. One moment does not define a diagnosis. In medical care, we look for patterns, duration, and context. We also consider medications, infections, sleep quality, and emotional strain, all of which can influence mental clarity. What I want older adults to hear most clearly is that noticing confusion does not mean you have done something wrong. It means your body is communicating. The aging brain is sensitive, but it is also resilient. It responds best to calm explanations and steady routines. When people feel rushed or frightened, confusion often worsens. When they feel safe and respected, clarity has room to return. In my practice, I have seen how dignity changes outcomes. When seniors are invited into the conversation and given time to process information, they remain engaged and confident. Mental confusion becomes something we observe together rather than something we fear alone. This approach honors both the science of the brain and the lived experience of aging. Understanding what mental confusion really means allows us to respond with patience instead of alarm. It helps families listen more closely and helps individuals trust their inner signals. With that foundation, we can talk more clearly about why certain symptoms are missed and how gentle awareness protects both health and peace of mind. How Nipah virus can affect thinking. When we talk about how a virus like Nipah can affect thinking, it helps to begin with how the body usually responds to any infection. The immune system is designed to protect us. When it senses something unfamiliar, it activates a series of responses meant to contain and control the threat. This process is thoughtful and layered, not sudden or chaotic. In many people, especially older adults, the brain can feel these changes before the rest of the body shows obvious signs. The brain is closely connected to the immune system through blood flow, hormones, and chemical messengers. When the body is working hard to manage an infection, these signals can temporarily change how the brain functions. Thinking may feel slower. Attention may drift more easily. Words may feel harder to reach. This does not mean the brain is damaged. It often means the brain is responding to a body that is under stress. With Nipah virus, doctors pay close attention because this virus can sometimes cross into the nervous system. When that happens, the body increases its protective response. Inflammation can rise as immune cells try to limit spread. Inflammation is not an enemy, it is part of healing. Yet in the brain, even small shifts in inflammation can affect clarity, mood, and awareness, especially in older adults whose brains are more sensitive to change. I often explain this to patients by saying that the brain is like a quiet room that notices every sound. When the body is fighting an infection, that room becomes busier. Messages come in more frequently. The brain works harder to sort them. During that time, thinking can feel less smooth. This is why confusion may appear gradually rather than all at once. It can come and go depending on rest, hydration, and emotional state. What matters most is understanding that this process follows a sequence. The body reacts first. The immune system signals next. The brain responds to those signals. In many cases, as the body stabilizes, thinking improves. This is why doctors observe over time, rather than reacting to a single moment of confusion. Older adults often ask me if this means something permanent is happening. Most of the time, it does not. The brain has an impressive ability to recover when it is supported with calm surroundings, regular sleep, gentle nutrition, and reassurance. Fear and urgency can interrupt that recovery. Safety and routine help restore balance. By understanding how Nipah virus can affect thinking through the body's natural responses, we replace uncertainty with clarity. This knowledge allows seniors and caregivers to remain steady, observant, and compassionate, trusting that the body and brain are communicating rather than failing. Why? Early confusion can be subtle. Early confusion is often subtle because the brain is very skilled at compensating, especially in people who have spent a lifetime adapting to change. In older adults, the mind has learned how to work around small disruptions. When clarity dips slightly, the brain fills in gaps using routine, familiarity, and experience. This is why early changes can feel vague and easy to dismiss. A person may still function well while quietly feeling that something is just a little off. Fatigue is one of the most common reasons these changes are overlooked. As we age, the brain requires more rest to maintain sharp focus. A poor night of sleep, dehydration, or even an emotionally busy day can leave the mind feeling slower the next morning. Many seniors tell me they assume this is simply part of getting older, so they do not mention it. In reality, the brain is signaling that it needs steadiness and recovery, not judgment. Stress also plays a quiet role. Emotional strain affects thinking more than many people realize. Worry about family, health appointments, or changes in routine can subtly drain mental energy. When the brain is managing stress, it has less capacity for attention and memory. This can look like mild confusion, misplaced items, or difficulty following conversations. These moments often pass, which reinforces the belief that they are not important. Yet patterns over time are what matter most. Another reason early confusion is subtle is timing. Many older adults feel their best in the morning and less clear later in the day. This pattern, sometimes called late-day fogginess, reflects how the brain tires as stimulation builds. It does not mean something is wrong, but it does mean the brain is sensitive to pace and rest. Without understanding this rhythm, families and even professionals may overlook early signs. In my clinical experience, early confusion is rarely dramatic. It whispers rather than announces itself. A person may take longer to respond. They may pause before answering a familiar question. They may feel overwhelmed by tasks that once felt simple. These changes are easy to miss because they blend into normal life. They are also easy to excuse because no one wants to worry unnecessarily. What I encourage seniors and caregivers to remember is that subtle does not mean insignificant. It means gentle. The brain is asking for attention, not alarm. When these early changes are noticed with patients, they often respond well to routine, hydration, consistent sleep, and emotional reassurance. Feeling safe allows the brain to settle. Feeling rushed can make confusion feel worse. Understanding why early confusion can be subtle helps us listen more carefully to the body's quiet messages. It reminds us that aging is not a sudden shift, but a gradual conversation between the brain and the life it supports. When we honor that conversation, we protect both clarity and dignity. Why? Doctors sometimes miss these signs. Doctors sometimes miss early signs of mental confusion, not because they are careless, but because the healthcare system often moves faster than the human experience of aging. Most medical visits are brief. They are designed to address clear symptoms, test results, and immediate concerns. Subtle changes in thinking do not always fit neatly into that structure, especially when they come and go or do not disrupt daily function in obvious ways. In a typical appointment, a doctor may have only a short window to listen, examine, and respond. If a patient appears oriented, answers questions appropriately, and does not raise specific concerns, deeper cognitive changes can remain hidden. Many older adults are also skilled at presenting their best selves in medical settings. They may focus, concentrate, and perform well during a short visit, masking the quiet challenges they experience at home. Another reason these signs are missed is language. People often describe confusion in gentle terms, saying they feel tired, distracted, or forgetful. These words are common and can reflect many benign causes. Without a clear pattern or history, it is difficult for any clinician to know whether these moments are temporary or part of a larger change. Medicine relies on trends over time, yet appointments often capture only a single moment. Caregivers and family members also play an important role, but they may not always be present or may hesitate to speak up. They may worry about embarrassing their loved one or fear causing unnecessary concern. As a result, valuable observations remain unspoken. This silence is understandable, but it limits the full picture a doctor needs to understand subtle changes. From my own experience, I have learned that the most meaningful information often emerges when there is time to listen without interruption. Unfortunately, the healthcare system does not always allow for that pace. This is not a failure of individual doctors, but a reflection of a system designed for efficiency rather than conversation. Subtle cognitive changes require context, history, and trust, all of which take time. What helps is preparation and partnership. When seniors or caregivers keep gentle notes about changes, patterns become clearer. Sharing these observations calmly can transform a brief visit into a more complete understanding. Doctors are trained to respond to information, and when that information includes lived experience, care becomes more accurate. Recognizing why doctors sometimes miss these signs allows us to respond with compassion rather than frustration. It encourages patience with the system while also empowering individuals to speak about what they notice. When understanding flows both ways, subtle signs gain the attention they deserve, and dignity remains at the center of care. How the aging brain responds differently. The aging brain responds differently, not because it is weaker, but because it has changed with time and experience. After decades of learning, adapting, and solving problems, the brain becomes efficient in ways that are often invisible. It relies more on patterns, familiarity, and rhythm. When something interrupts that rhythm, such as illness, stress, or disrupted sleep, the brain may take longer to adjust. This pause is not a failure. It is a sign that the brain is asking for steadiness. In older adults, the brain processes information a bit more slowly, but it often processes it more thoughtfully. It prefers clear signals over noise and calm over urgency. When the body is under strain, the aging brain can become sensitive to changes in temperature, hydration, medication timing, or emotional tone. Even small disruptions can affect clarity. What helps most is consistency. Regular meals, familiar routines, and predictable rest give the brain the structure it needs to regain balance. I often remind patients that the aging brain values safety. When a person feels rushed, corrected, or pressured, the brain may retreat. Words may come more slowly. Attention may wander. When the environment feels patient and respectful, clarity often returns. This is especially important when mental confusion appears alongside illness. The brain needs time to sort through signals and decide what matters most. Another difference is recovery time. A younger brain may rebound quickly after stress or infection. An older brain may recover just as fully, but more gradually. This slower pace can be mistaken for decline when it is actually a healing process. Rest is not a setback, it is part of repair. Allowing time for recovery protects confidence and reduces unnecessary worry. The aging brain also carries memory differently. It may take longer to retrieve names or details, yet it holds deep understanding, emotional wisdom, and judgment. These strengths remain even when surface clarity feels uneven. Recognizing this helps families and caregivers respond with respect rather than impatience. It also helps seniors trust themselves instead of doubting every pause. From a caregiving perspective, the most powerful support is stability. Gentle cues, familiar surroundings, and consistent schedules help the brain feel anchored. Hydration and sleep play a larger role than many people realize. Emotional reassurance matters as much as physical care. When the brain feels protected, it works more smoothly. Understanding that the aging brain responds differently allows us to replace comparison with compassion. It shifts the focus from what is slower to what is still strong. With time and stability, the brain often finds its footing again. This approach honors dignity and reminds us that aging is a process of adjustment, not loss. At this point in our conversation, I want us to pause together for a moment. Understanding health, especially changes in thinking, can feel personal and sometimes emotional. You are not listening alone. Every day, many older adults sit quietly with similar questions, wondering if what they notice matters, or if they should simply move on. This space exists so those questions can be held gently. I have learned over the years that healing often begins with feeling accompanied. When people know they are not being judged or rushed, their minds relax. Clarity becomes easier to find. That sense of safety is what we aim to create here. Senior Health Daily is not just about information. It is about building a steady, respectful community where learning happens at a pace that feels right. I want to say this directly and from the heart. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. When you choose to stay connected, you help ensure that thoughtful conversations about aging, memory, and dignity remain available to those who need them most. Sharing this space allows others to feel less isolated in their questions. It reminds caregivers and seniors alike that understanding does not have to come with fear. If you are watching with someone you care about, take a breath together. If you are watching alone, know that you are still part of something larger. This community values patience, routine, and respect for the aging journey. There is no pressure to decide anything right now. Listening and reflecting are enough. As we continue, we will return to learning with the same calm tone and steady care. Thank you for being here and for helping create a place where health information feels human and reassuring. Emotional safety and mental clarity. Emotional safety plays a quiet but powerful role in mental clarity, especially as we grow older. The brain does not function in isolation. It responds to the environment, to the tone of voices around it, and to the rhythms of daily life. When a person feels safe, unhurried, and respected, the brain has more room to organize thoughts and maintain focus. When the environment feels tense or unpredictable, even a healthy brain can struggle to stay clear. Sleep is one of the most important foundations of emotional safety. The aging brain relies on consistent, restorative sleep to sort memories and reset attention. When sleep becomes fragmented, thinking often feels foggy the next day. This does not mean something is wrong. It means the brain did not have enough quiet time to restore itself. Establishing a gentle bedtime routine, keeping lights low in the evening, and maintaining regular sleep hours can make a noticeable difference in clarity. Daily rhythm matters just as much. The brain thrives on predictability. Regular mealtimes, familiar activities, and a steady pace help the mind anticipate what comes next. This reduces the mental effort required to stay oriented. When routines are disrupted, the brain must work harder to adjust, and confusion can surface more easily. For older adults, returning to familiar patterns often brings a sense of grounding that supports clearer thinking. Emotional tone also shapes mental clarity. Conversations that feel rushed or corrective can increase anxiety, even when intentions are good. Anxiety narrows attention and makes it harder to process information. Calm voices, simple explanations, and patience widen that space again. In caregiving, how something is said often matters more than what is said. Respectful communication reassures the brain that it is safe to engage. I have seen many patients improve simply by feeling understood. When fear is reduced, the brain responds with greater focus. Emotional safety lowers stress hormones that interfere with thinking. It allows the nervous system to settle. This is especially important for seniors who are already managing physical changes or illness. The brain needs reassurance that it is not under threat. Mental clarity is not only about biology, it is also about environment and experience. A quiet room, familiar music, gentle light, and a predictable day can support cognition in ways medication cannot. These elements send a message of safety to the brain. That message allows attention, memory, and awareness to work more smoothly. By honoring emotional safety, we support the brain's natural ability to regain balance. Clarity grows in spaces where patience is practiced and dignity is protected. When the mind feels secure, it has the freedom to think clearly and respond with confidence. Mental confusion and dementia. Care. Mental confusion and dementia are often spoken about together, yet they are not the same, and understanding the difference matters deeply for emotional safety. Acute confusion can appear during illness, infection, dehydration, medication changes, or significant stress. It often develops quickly and may improve as the body stabilizes. Dementia, on the other hand, is a gradual process that unfolds over time, marked by persistent changes in memory, reasoning, and daily function. The key difference is not the word itself, but the pattern and the pace. In my years of caring for older adults, I have seen how easily these experiences can be confused. A person may become disoriented during a short illness and worry that this moment defines their future. Families may fear the worst when they notice a change. What helps is slowing down and observing. Acute confusion tends to fluctuate. Some hours are clearer than others. Rest, hydration, and reassurance often bring improvement. Dementia does not resolve in this way. It shows consistency over months and affects familiar routines in a more enduring manner. Gentle observation protects dignity. Labels applied too early can cause unnecessary distress and change how people see themselves. The brain is sensitive to expectation. When someone is told they are failing, anxiety can increase and clarity can decrease. When someone is told they are being observed with care and patience, the brain often settles. This is why thoughtful language is part of good care. Dementia care, at its heart, is about support rather than definition. It focuses on maintaining comfort, routine, and connection. It honors remaining strengths and adapts the environment to reduce strain. Acute confusion requires a different response. It asks us to look for triggers, to review medications, to support the body while it heals. Both approaches value patience and respect, but they begin from different questions. I often remind families that a diagnosis is not the first step. Listening is. Watching how someone moves through their day, how they respond to reassurance, and how patterns change over time gives far more information than a single test or moment. This approach reduces fear and allows care to be guided by evidence and compassion. For seniors, knowing this difference brings relief. It restores a sense of agency. A moment of confusion does not erase a lifetime of competence. It does not define identity. With the right care, many episodes pass, and even when long-term changes exist, life can still be meaningful and connected. By distinguishing acute confusion from dementia with gentleness, we protect emotional well-being. We keep curiosity open and fear quiet. This balance allows both individuals and caregivers to move forward with steadiness, trust, and dignity. What families and caregivers should notice. Families and caregivers often notice changes before anyone else, simply because they share the rhythm of daily life. What matters most is how those observations are held. Noticing does not mean reacting immediately. It means watching with patience and curiosity. Small shifts in attention, memory, or mood are best understood when they are seen as part of a pattern rather than isolated moments. I encourage families to notice how a loved one moves through familiar routines. Are mornings clearer than evenings? Does confusion increase when the day feels rushed or when sleep is disrupted? Does reassurance bring calm? These gentle questions help separate temporary strain from changes that deserve closer attention. Observation over time gives the brain space to reveal what it needs. Tone matters deeply. When questions are asked with concern rather than alarm, the brain feels safer responding. Correcting or testing someone can increase anxiety and make confusion worse. Instead of pointing out mistakes, it helps to offer support and redirection. Simple phrases like, "Let us take this one step at a time," can lower stress and preserve dignity. Caregivers should also notice emotional signals. Withdrawal, irritability, or quiet frustration can accompany confusion. These are often responses to feeling overwhelmed rather than signs of decline. When emotional needs are met with patience and respect, clarity often improves. The brain responds well to feeling understood. Another important aspect is noticing what helps. Does hydration improve focus? Does a short rest restore attention? Does familiar music or a calm environment bring ease? These details are valuable. They tell a story about how the brain responds to support. Sharing these observations with healthcare providers can guide care more effectively than a list of symptoms alone. It is also important for caregivers to care for themselves. Worry and fatigue can color perception. When caregivers feel supported and informed, they observe more clearly and respond more calmly. This balance benefits everyone involved. I remind families that noticing is an act of care, not surveillance. It is about staying present and attentive without assuming the worst. When changes are approached with steadiness and compassion, the person experiencing them feels less alone. That sense of safety often becomes the most powerful form of support. By observing with patience and without judgment, families and caregivers help protect both clarity and confidence. This approach honors the person behind the symptoms and keeps relationships rooted in trust and dignity. Why awareness protects dignity? Awareness protects dignity because it allows understanding to arrive before fear does. When older adults understand what changes may mean and what they do not mean, they remain active participants in their own care. Awareness replaces silence with language and confusion with context. It gives people permission to speak about what they notice without feeling judged or diminished. Early understanding supports autonomy. When seniors recognize subtle changes and feel safe discussing them, they can make choices that reflect their values. They can ask questions, adjust routines, and invite support on their own terms. This preserves a sense of control that is essential to well-being. Being informed does not take power away. It gives it back. Respect grows when awareness is shared. Families and caregivers who understand early signs are more likely to respond with patience instead of correction. Conversations become collaborative rather than directive. The person experiencing changes is seen as someone navigating a moment, not someone defined by it. This perspective keeps relationships balanced and humane. From a medical standpoint, awareness allows care to be thoughtful rather than reactive. Doctors can observe patterns over time instead of rushing to conclusions. This leads to better decisions and reduces unnecessary anxiety. It also honors the complexity of aging. The brain does not change in isolation. It responds to health, emotion, environment, and history. I have seen how dignity is preserved when people feel heard. Seniors who are invited into conversations about their health remain confident even when facing uncertainty. They understand that noticing change is not a weakness. It is wisdom earned through experience. This mindset protects self-respect and emotional stability. Awareness also supports routine. When changes are recognized early, small adjustments can be made to support clarity. Regular sleep, consistent meals, calm surroundings, and predictable days become tools of care rather than reactions to crisis. These supports reinforce independence and comfort. Ultimately, awareness affirms worth. It tells older adults that their experiences matter and that their voices are central to their care. Understanding does not rush or label. It listens. By valuing awareness, we protect dignity at every stage of aging and remind ourselves that clarity and respect can grow together. As we come to the end of our time together, I want to slow everything down and thank you for staying and listening. Giving your attention to your health, especially to something as personal as mental clarity, is an act of care in itself. For today, understanding and noticing are enough. There is no need to take action right now, and no need to carry worry forward. Simply being aware is already a meaningful step. Over many years of caring for older adults, I have learned that medical knowledge should never feel heavy. It should offer reassurance and direction, not pressure. When information is shared calmly and with respect, it becomes something that supports you rather than something that weighs on you. Your body and your brain are not problems to be solved. They are systems that communicate, adapt, and respond when they are given patience and safety. Senior Health Daily exists for moments just like this. It is a place you can return to whenever health information feels too loud or confusing. There is no urgency here, and no expectation that you have everything figured out. This space is built on steady companionship and the belief that learning works best when it feels human. I want you to remember that aging is not a loss of wisdom. It is a deepening of it. The brain has an extraordinary ability to adapt, even when changes appear. With routine, emotional safety, and gentle understanding, clarity often finds its way back. Trusting that process allows you to move forward with confidence instead of fear. Thank you for sharing this time with me. I hope you leave this video feeling calmer, more grounded, and more trusting of your own experience. Senior Health Daily will be here whenever you need a quiet place to listen, reflect, and feel supported on your health journey.